We're in a small Appalachian area clinic. My name's Betty Hopkins. When we started WIC 40 years ago, I was the nurse, still the nurse.
I'm Martha Blair, and I'm a retired public health nurse. We're celebrating 40 years of WIC's existence.
WIC stands for Women, Infants, and Children. It's a food program for people that are on a low income. It helps supplement their food package so they'll have a healthy, well-balanced diet.
Getting the food and the education along with it, they learned more about nutrition along the way.
And if you start out with a healthy infant, you got a healthy adult.
40 years ago, I doubt if they saw it being here 40 years later, because most programs do kind of come and go. So I think having a 40th birthday for WIC is very appropriate.
Happy birthday, WIC program!
It was 1974, the very first day that they issued the first WIC voucher. It was a big to-do, and we were proud because that was something. Bell County got to be the first WIC program in the whole United States. Martha Blair was the nurse director at that time, and she and Elaine Perkins wrote the first grant for the WIC program.
We were notified that the grant writing could start and we could be a part of competing for that money. And our medical director was Dr. George Dayhue at the time, and he just pulled us aside and said he wanted the grant written like that day. And much to our surprise, it was funded, and Pineville was the first to actually spend the vouchers.
The clinic was very busy that day. All our patients were excited about receiving formula for their babies, and then of course the pregnant mothers also got a food package. One of the main things that impressed me was the infants. When they got on WIC, they had to have the iron fortified formula, and 1 year after the WIC program started, the babies, they weren't anemic like before.
It became a very good opportunity to coordinate well-child visits and the immunizations and services that the children really needed.
And now all the nurses counsel the mothers on diet, obesity, health, food safety, and we always encourage them to breastfeed because of the benefits that the infants get.
I think it's one of the best programs that we've had that served a lot of people for the amount of dollars. There were a lot of growing pains with it because it was difficult for the patients to understand the voucher system that was set up for it. It was very time-consuming. You know, it's much more streamlined now.
They've been more foods added to the packages since it started, and they have more choices like in vegetables and fruits that we did not have in the beginning.
It's a blessing to be able to see something that I worked so hard on 40 years ago is still a big benefit to the community.
Happy birthday to the 40 years of WIC, and I hope it goes 140 more.